Today's tip is all about sick sinus syndrome, which triggers HCC 96. Sick sinus syndrome is not a specific disease, but rather a group of signs and symptoms that indicate that the heart's natural pacemaker, the sinus node, is not functioning properly. This can cause many different symptoms, such as angina, bradycardia or tachycardia, confusion, dizziness or lightheadedness, dyspnea, fatigue, palpitations, syncope, and weakness. The ICD-10 code for sick sinus syndrome is I49.5. If the patient has a pacemaker, the code is Z95.0, sick sinus syndrome with the presence of a cardiac pacemaker. It is considered a coexisting chronic condition if the physician evaluates and documents the patient's sick sinus syndrome and the function of the pacemaker in the same visit. In order to properly report sick sinus syndrome with the presence of a pacemaker, the documentation requires at least one of the following: pacer management, clinical evaluation of function, therapeutic treatment, diagnostic procedures to determine function, an extended hospital stay, increased monitoring of the pacemaker, or its battery or lead placement. Here are some examples of how to properly document the assessment and plan for a patient with sick sinus syndrome with a pacemaker. Remember, if the patient has a pacemaker and has been diagnosed with a sick sinus syndrome, both should be documented and reported. Always remember to say what you see. Thank you for watching. I'm Dr. Diaz, and this has been your MRA Tip of the Day.